Are you ready to learn with fun? Brace yourselves for the ultimate test of knowledge in the Cardiac Super League. Witness the clash of giants as 12 formidable teams step into the arena, battling it out for cardiology supremacy. In this exciting collaboration between Wilson's Pharmaceuticals and the Pakistan Cardiac Society, the Cardiac Super League promises intense competition and groundbreaking learning experiences. Stay tuned as the teams showcase their expertise, strategic brilliance, and unwavering determination. Who will emerge as the true champions in cardiology? The main goal of the case-based learning approach is to equip students and healthcare professionals to refine their clinical practice by learning the latest advancements. The Cardiac Super League awaits you, guaranteeing to advance your education. Join us and become part of an incredible journey. Visit our Facebook page or contact us for more information.
Assalamu alaikum everyone, this is Hamza Hussain and we are live for the Pakistan Cardiac Super League 4th quarter-final match between AFIC Lions and Multan Institute of Cardiology Panthers. Umpires for today's match is Professor Mohammad Ishaq. He is Professor of Cardiology at Karachi Institute of Heart Disease, and along with him our panelist is Brigadier Abdul Hamid Siddiqui. He is Associate Professor of Cardiology at AFIC and NISG Rawalpindi. And allow me to introduce moderator as well. After a very long gap, we have with us Professor Dr. Hamza Gauri. He is Assistant Professor of Cardiology at Rawalpindi Institute of Cardiology, and I will request Dr. Hamza Gauri to please start the proceeding of this 4th quarter-final match.
Thank you very much, Hamza. It's great to be back after a long time, a long gap. I think this league is doing wonders. So all thanks to Cardiac Super League for putting up this show, and I think this was only possible because of Wilson's Pharmaceutical along with Pakistan Cardiac Society. Now today, it's a crucial game. As we all know, it is the last of the quarterfinal matches, and it's between Armed Forces Institute of Cardiology Lions versus Multan Institute of Cardiology Panthers. So with this, I would also like to move on towards our worthy and highly esteemed panels and panelists who are there. And I think we have, along with the panelists, I welcome them all. And along with that, I think we have one and only our umpire for the game, that's Professor Mohammad Ishaq. Sir, it's always great to have you along with the whole panel. I think he's always been there and extremely instrumental for all the games. So I now would like to move on to the two teams and the two team captains. I would request them to introduce the teams. So we start with Multan Institute of Cardiology and the captain. Please have the introductions.
I am Dr. Bilawal, captain of MIC Multan, and alongside with me, Dr. Farooq, Dr. Rafiq, and Dr. Proki.
That's great. I think we welcome you all and best of luck for the game today. So Armed Forces Institute of Cardiology Lions, your introductions, please.
I'm Dr. Ismail. I'm the team captain of AFIC Lions. To my left is Dr. Hassan Riaz, and to my right are sitting Dr. Sana Sarfaraz and Dr. Maida Anwar.
So I welcome you all and best of luck for the game today. So with this, I would now seek permission from the worthy council members to start the game. Shall we, sir? Okay, so now I move on to the toss today. It's going to be a coin toss. So can we have the coin toss on the screen? And I'm going to randomly ask one of the teams. So AFIC Lions, I would request you to call. Heads or tails?
Heads is a call.
So heads is the call. Here we go. And it's tails. So MIC, Multan Panthers have won the toss. So what have you decided? Are you going to take the questions or you want to throw the questions?
Sir, we would like to take the question. We will bat first.
Okay, so Multan has actually decided to take the questions, right?
Yes, sir.
Okay, AFIC, are you ready?
Yes.
Questions?
Yes.
Okay, so can we have the first question and their vignette on the screen? Here we go.
A 26-year-old female delivered 1 month ago presented in the ER with a history of shortness of breath along with problems during sleep and lying down also. For last 1 week, she developed this issue around 2 weeks after pregnancy and now progressed significantly. She has 3 babies before, but didn't develop this sort of issue. On examination, she is short of breath, orthopnic, and profusely sweating. Her blood pressure is 103 by 63 millimeters of mercury. Pulse is 116 beats per minute, and SpO2 is 81% on room air.
Okay. So, Multan, have you gone through the vignette? Are you ready?
Yes, sir.
Okay. So, can we have the first question on the screen?
Question number 1 is, what is the exact definition of this disease according to 2010 Heart Failure Association of the European Society of Cardiology Working Group? Option A, heart failure presenting in the last month of pregnancy and up to 5 months postpartum with left ventricular systolic dysfunction. That is left ventricular ejection fraction of less than 45% or fractional shortening of less than 30% when where no other cause of heart failure is found. Option B is heart failure presenting in the last month of pregnancy and up to 5 months postpartum with left ventricular systolic dysfunction. That is left ventricular ejection fraction less than 55% or fractional shortening of less than 30% where no other cause of heart failure is found. Option C is heart failure that occurs towards the mid of pregnancy or in the months following delivery where no other cause of heart failure is found. Option D, heart failure that occurs towards the end of pregnancy or in the weeks following delivery where no other cause of heart failure is found. And option E is heart failure that occurs towards the end of pregnancy or in the months following delivery where no other cause of heart failure is found.
Okay, so the timer starts now. 90 seconds.
Sir, I think I will go with the option A.
Okay, so are you sure? Should we lock it?
Yes, sir.
Okay, then lock the option. Is it correct or not? Oh, okay, so never mind. I think let's move to the next question. So you get 0 marks for this. I hope you get a 6 on the next one. Question number 2.
Question number 2 is, all of the following are risk factors for this disease except option A, younger maternal age, option B, advanced maternal age, option C, preeclampsia, option D, multiple gestations, option E, hypertension.
And the time starts now. I hope you will play with a straight bat. So we are closing in on 30 seconds. Come on, Multan.
Lock option C.
Sure? Should we lock?
Yes.
Okay. Lock option C. Oh, goodness. Okay, so another edge into the slip. Okay, never mind. We move to the question 3.
Question number 3. History revealed that her elder sister had some issue of heart in pregnancy, but she's not clear what was the issue. Regarding familial nature of this disease, which one of the following is most accurate? Option A, there is a strong correlation of familial genetic pattern in this disease. Option B, possibility of a heterogeneous pathophysiology that hypertensive mechanisms and a certain genetic susceptibility may both cause peripartum cardiomyopathy through different mechanisms and merits further study. Option C, study suggests some link but needs further study. Option D, genetic pattern is studied in some patients but merits further study. Option E, two-hit method is suggested in which there is vascular insult in addition to genetic susceptibility is hypothesized.
And timer starts now, 90 seconds. So I know it's been some aggressive field setting by FIC. Let's see how Multan copes up with that. And I can see the mentors from FIC, they're also pretty geared up. Thirty seconds remaining. Fifteen seconds, come on. 10 seconds, hurry up. Pick an option.
Option E.
Okay, option E, lock option E. And there you go. You're on the board, Multan. Well played. Well done. So question number 4 on your screen, please.
Question number 4 is, as you are managing the patient in ER, one of your ER colleagues who is preparing fellowship exam in cardiology asked you regarding the role of prolactin in development of peripartum cardiomyopathy. What is true regarding the role of prolactin in peripartum cardiomyopathy? Option A, 16 DKA prolactin exerts cardiotoxic effects through upregulation of microRNA. B, 16 DKA fragment causes endothelial cells to release exosomes containing MIR-146A. C, MIR-146A blocks several pathways, including ERBB4, NRAS, and Notch1 that lead to cardiomyocyte death. Women with option D, women with peripartum cardiomyopathy have raised level of circulating 16 DKA. Option E, bromocriptine, a prolactin inhibitor, has a very significant role in the treatment of peripartum cardiomyopathy.
Okay, so your time starts now. 90 seconds. This surely is a quick delivery, as we can all see. Let's see how they cope up with this.
To me, it looks like a bouncer.
Sir, option E.
Okay, so option E, E for elephant.
Yes, sir.
Are you sure? Should we lock it? Should we lock option E?
Yes,
So we
yes.
need confirmation.
Okay. So I think we got this one wrong. So I think definitely it turns out that it was a bouncer. And never mind, I think AFIC is bowling fast, and MIC, I think, will get more aggressive down the line, hopefully. So can we have the next question on the screen? Question number 5.
Question number 5 is patient is shifted to CCU. IV diuresis started with IV nitrates. Patient subsequently develops cyanosis along with dizziness, confusion, nausea, and vomiting. You are suspecting methemoglobinemia. What would be the level of methemoglobinemia in this patient? Option A, 2 to 5%. Option B, 5 to 10%. Option C, 10 to 15%. Option D, 15 to 20%. Option E, 20 to 30%.
Time starts now. 90 seconds on your screen. Come on, Multan, you've got to swing hard. You've got all to play for. We are closing in on 30 seconds.
Lock option D.
Option D,
G, delta.
delta. Okay. Lock option D, delta. Oh, another one missed. Oh, okay. That's good bowling, I would say. But then I think we have to move to question number 6. Come on, Multan. Panthers, you've got to move like Panthers now.
Question number 6. You stopped IV nitroprusside and started methylene blue for treatment of methemoglobinemia. Symptoms improved subsequently. Patient's symptoms of heart failure settled also within a day. You planned echocardiography to confirm the diagnosis. All of the following findings would support of the diagnosis except option A, left ventricular dilation. Option B, left ventricular dysfunction. Option C, left ventricular thrombus. Option D, left atrial dilation. Option E, right ventricular dysfunction.
Time starts now. And I do see Multan's batter moving out of the crease. Let's see. And I think it's going to be a 6.
Lock option E.
Are you sure? Should we lock E for elephant? Okay then. Lock option E. Oh, goodness. He's been stumped. Oh, I guess we'll have to face the next one. I think we move to question number 7.
Question number 7 is diagnosis of peripartum cardiomyopathy is confirmed as patient has left ventricular dysfunction with no other explanation of this LV dysfunction. Patient was doing fine while on 4th day, you noticed yellowish discoloration of her sclera. Her hemoglobin dropped to 5 milligrams per deciliter. What would be the most likely explanation of this finding in context of her ongoing illness? Option A is congestive. Option A is congestive liver due to heart failure. Option B is cardiac cirrhosis. Option C is methemoglobinemia induced hemolysis. Option D, some congenital deficiency of any enzyme. Option E, none of the above.
And the timer starts now. Multan, be careful. Panthers, you need all these 4 questions now. You've got to score.
Lock option C.
Multan, are you sure?
Yes, sir.
Should we lock it?
Yes.
Okay, lock please. Option C. Oh, goodness. That's a wrong answer. Oh, I was really hoping that we would get on the board, but Multan, 3 more to go. Play it well. Question number 8.
Question number 8 is, patient was diagnosed as having glucose 6-phosphate dehydrogenase deficiency, which is precipitated by methylene blue. Impact of G6PD deficiency in this patient with heart failure would be: option A, increased susceptibility to free radical injury. Option B, impairment of intracellular potassium transport in human. Option C, ACE inhibitor have role in counteracting the effects of G6PD deficiency in these patients. Option D, MRA have role in counteracting the effects of G6PD deficiency in these patients. Option E, none of the above.
Timer starts now. 90 seconds. So it seems like hostile bowling. I think bodyline tactics. But come on, guys. You've got to hook it well now.
I hope only 2 bouncers are allowed.
We all hope so, sir, but I think it's been pretty aggressive bowling so far. And I'm keeping my fingers crossed for Multan.
Option A, alpha.
30 seconds to go. So, are you sure? Should we lock the option?
Yes, sir.
Okay, lock option A. Yes.
Thanks God, thanks God. We are moving
Very
somewhere.
well played. Very well. Definitely, sir. Very right. Thank God. So we are definitely on the board. We've got 12 on the board. 2 more questions, rather deliveries to go. I hope it goes well. Question number 9 on your screen.
Question number 9 is, patient was managed successfully and she improved remarkably after 2 weeks. She asked you regarding her change of improvement in heart function. Which of the following statement is true regarding her prognosis? Option A, 20 to 30% of women with peripartum cardiomyopathy recover to normal range left ventricular systolic function, that is LVEF greater than 50%, with most of this recovery occurring within the first 6 months. Option B, left ventricular size and ejection fraction at the time of diagnosis is the least reliable factor for prediction of left ventricular recovery. Option C, the vasodilatory and proangiogenic hormone relaxin was associated with more left ventricular dilatation at diagnosis and left ventricular and late recovery of left ventricular function. Option D, the presence of late gadolinium enhancement on CMR does not correlate with the recovery of LV function. Option E, peripartum cardiomyopathy has been associated with a higher rate of recovery than other forms of heart failure with reduced left ventricular ejection fraction.
And the timer starts now on your screen. Extremely difficult bowling, I know, but this is the pitch that you'll get to play on most of the times. You'll come across these patients with peripartum
We are
cardiomyopathy.
expecting further rain.
Lock option E.
Are you sure? That's pretty quick.
Yes, sir.
Okay, they are very confident. Lock option E.
Luck. Good.
Yes, they were rightly confident. Very well played. Well done.
I think अभी तक ये सोए हुए थे, अभी थोड़ा जाग गए हैं.
Very right, sir. But just one more delivery to go. And I hope they play that well as well. So, moving on to the next question. The last one.
Question number 10 is, patient is concerned regarding risk of this disease in subsequent pregnancy if she recovered completely from this problem. Which statement is true? Option A, rate of relapse in patient is around 20%. Option B, there is role of beta blocker in prophylaxis. Option C, C-section is preferred in next pregnancy to avoid the hemodynamic impact of labor on heart. Option D, there are significant chances of deterioration if she developed cardiomyopathy in the next pregnancy. Option E, all of the above.
Your 90 seconds start now. Play it well.
Lock option E.
Are you sure? You still have
Yes, sir.
time? You want us to lock the option?
Yes, sir.
Okay. Lock option E. Oh. Well. So
Well
last
done.
one. Okay. So I guess we have had all the deliveries and the score is 18.
18.
Right. So I think 18, whether that's a competitive score, we'll have to see, but definitely Multan will have to bowl pretty well. And I think we've come to the end of this first innings. And with this, I would like to take some input from our worthy council members and our umpire for the game, Professor Dr. Ishaq. Sir, your input, please.
Well, I enjoyed. Very nice. Questions are very good, very pertinent, and actually, we are also learning quite a few things that we have forgotten. And these new terminologies and new guidelines, as being practiced now, I think it's a very interesting to watch this kind of match and the teams competing. I think Multan did very well at the end, but initially they had some problems. 18 is not a very big score. So let's see how the other guys do. But I think the standards of questions and scenario, they are quite good. They are quite up to the mark. And I think जो क्वेश्चन ने गलत किए हैं इनको थोड़ा सा they should ponder. The other thing I wanted to tell is that we've got 90 seconds and I think they should take their full time before they make a decision. 90 seconds के अंदर they can have good discussion and maybe those questions that they marked as wrong could have been right, you see. So इसमें जल्दी ना करें, अपना time पूरा लें and think properly, carefully, and then decide the answer. So anyhow, thank you very much, Hamza. You're doing well. And I think let's move on.
Right, sir. Thank you very much, sir. I think your very important points, key points, I think all those aspects are very important. And we also have Dr. Abdul Hamid Siddiqui. I would like to take his opinion on the game so far. I know he's pretty much geared up and looking pretty confident. Sir, over to you.
Thank you very much, and warm regards to Professor Isaac and to you. And I think very practical scenario, but we understand that some of the questions were difficult. Going into the genetics of the disease that require immediate recall, sort of. So anyway, good competition going on, and let's see what FIC does. Thank you.
Thank you very much. So with this, we now move towards the second innings of the day. And do we have the teams ready?
Yes.
Yes, sir.
Okay. So, Multan, are you ready with the question?
Yes, sir.
And can we have the question and the vignette? Please read the question.
27 years old male and accountant by profession came in OPD with history of exertional shortness of breath for the last 6 months. He is obese and having sedentary lifestyle. Initially, he thought his dyspnea was due to weight and lifestyle, but it progressed and he came to have an evaluation. Precordial examination revealed systolic murmur of 3/6 at left lower sternal border, which accentuated in standing position from sitting position.
Okay. So, FIC, are you comfortable? Have you read the vignette? Should we move to the question number 1?
Yes.
Okay. Question number 1. Read the question, please.
All of the following will increase the intensity of the murmur except Valsalva phase 2, 3, Valsalva phase 4, exercise, amyl nitrate, isopreterenol.
And your time starts now. 90 seconds.
बट उसके प्रीलोड बढ़ने से उसका मरमर बढ़ा है. एक्सरसाइज आफ्टर लोड बढ़ाएगा. अमाइल नाइट्रेट आफ्टर लोड कम करेगा.
अमाइल नाइट्रेट वेसोडाइलेशन करेगा, प्रीलोड कम करेगा.
हाँ.
आइसोप्रोपेरिनॉल जो है वो सिम्पथोमाइमेटिक है.
हाँ, वो वेसोकंस्ट्रिक्शन करा के.
और जब टेक्निक होगा प्रीलोड कम होगा. वेसोडाइलेशन करवाएगा, पेरिफेरल कूलिंग ऑफ ब्लड होगी, कूलिंग ऑफ ब्लड तो वीनस रिटर्न कम.
वेलसेल्वा से मरमर
सर देखिए लेफ्ट लोअर स्टर्नल पे से बताइए मरमर हमारा
हॉलो सिस्टोलिक मरमर था ना. ईआर का शायद था ये.
Closing in on 30 seconds.
राइट साइडेड मरमर से बोलते हैं वो रीलोड इंक्रीज कराने के. रीलोड कैसे सीडीई नहीं जाते हैं.
हाँ, वेलसेल्वा ही पे पूछता है.
सेल्वा
FIC closing in on 10 seconds. Come on.
Option A.
Are you sure?
Yes.
Option A for alpha.
Yeah.
Okay. Oh. So first delivery missed. Another swinger. I think that was an out swinger. Oh, yes. For sure. Well, question number 2 on your screen.
House officer mentioned that apical impulse in this disease would be a triple ripple. What comprises of triple ripple in this disease? Option A, early systolic dip, mid systolic bulge, palpable S4. Mid systolic dip, late systolic wave, palpable S4. Option C, early systolic dip, mid systolic bulge, and late systolic wave. And option D, early systolic dip, late systolic wave, and palpable S4. Option E, none of the above.
Your timer starts now.
S4 तो आपका होता है
LVH में. हाँ. हाँ.
प्रेशर ओवरलोड. तो
नहीं, राइट साइडेड है ना ये तो. हाँ.
प्रेशर ओवरलोड होगा उसके लिए.
Early systolic and apical impulse in this would be a triple ripple.
इसमें भी होता है, हुक में भी होता है. ट्रिपल रिपल में होता है. S2 होगा. तो A, B और D में से.
Early systolic dip, late systolic wave. Late systolic wave. A का रीजन क्या है? Mid systolic pulse, palpable S4, late systolic wave.
Spike and dome pattern to aorta का.
So closing in on 30 seconds.
Mid systolic depth.
Okay. I don't know. गलत हो गया.
Come on, Lions.
Late systolic है कोई इसमें नहीं. ऑप्शन डी कर लेते हैं.
10 seconds.
ऑप्शन डी.
D. D for Delta. Sure?
Yeah.
Okay, lock option D.
Yeah.
Oh, another good one. We've got a similar kind of a start. The pitch seems to be difficult today, especially in the opening overs. But I think that was a wonderful question. It really tested everyone's knowledge and the discussion was good. Question 3 on the screen.
Further history suggested that one of his brothers had also some heart issue. He does not know the exact nature of disease. His brother died at age of 31 years. Regarding genetic transmission of his disease, which of the following is true? Option A, it is an autosomal recessive disease. Option B, 25% siblings of the affected parents can have this. Option C, Hocum is known to be caused by mutations in 17 or more genes encoding proteins of the thick and thin contractile myofilament components of the cardiac sarcomere or the adjacent disease. Option D, MYH7 and myosin binding protein C are by far the most common. Option E, all of the above.
Your timer starts now. AFIC is yet to get on the board.
D इसका इसका D होना चाहिए. MYH7 MYBPC3 था. HEM is not because mutations. Genes तो काफी सारे इसके होते हैं. MYBPC3 MYH7 तो सबसे कॉमन है यही.
क्योंकि MYBP वाला कॉमन है.
मेरे ख्याल से तो D है. बाकी ऑटोसोमल डोमिनेंट है. CID में से मोस्ट प्रोबेबली मेरे ख्याल से D लॉक कर लें फिर या वांट टू टेक टाइम. D कर दो फिर मैं. We will go with option D, Delta.
Okay, so lock option D.
Yes, okay.
Very well played. Very well played indeed. So that's a 6. For sure, for sure. That's 6 over the mid wicket, I would say. Well played.
ये पहले 2-3 जो है ना उसके बाद गर्म होती हैं टीमें.
Like I said, sir, they're taking their time. But then again, I think this is make or break the next few questions. So let's move on to the next one.
On transthoracic echo, there is asymmetrical septal hypertrophy. LVOT gradient at rest is 39 mm of mercury. Severe MR is also noted during study. All of the following are possible mechanisms of MR in Hocum except asymmetric. Option A, asymmetric septal hypertrophy related abnormal pap muscle alignment. Option B, exaggerated SAM. AML is attracted towards LVOT with every systole that tend to keep the mitral valve unguarded and MR results. Option C, intrinsic abnormalities of the mitral valve. Option D, pacemaker mediated MR. Or option E, end stage Hocum left ventricular dilation.
And your time starts now.
ठीक है. A भी है, B भी है, C भी है. नहीं C नहीं है. A B और नहीं पेसमेकर कैसे MR
D pacemaker was used to induce desynchrony of the LVOT versus LV valve.
इंट्रिंसिक एब्नॉर्मैलिटी माइट्रल वाल्व की नहीं होती होकम के अंदर. इट्स नॉट क्योंकि प्राइमरी MR तो नहीं होता ना उसका. इट्स नॉट इट्स अ सेकेंडरी MR.
पेसमेकर वो एपिकल इम्प्लांटेशन होती है वो पेसमेकर मीडिएटेड MR. The following are possible mechanism of
ज्योमेट्रिकल डिस्टॉर्शन है, एक्सैजरेटेड सैम है, एंड स्टेज होकम LV डायलेशन भी है. वी हैव टू चूज बिटवीन C एंड D. जहाँ तक मेरा ख्याल है माइट्रल वाल्व की पर से है क्योंकि इट्स नॉट अ डिजीज ऑफ माइट्रल वाल्व. तो उस लिहाज से ऑप्शन C होना चाहिए. पेसमेकर के बारे में थोड़ा सा आई एम नॉट श्योर। टीआर तो
Closing
पेसमेकर
in on
चलाता है,
30 seconds.
टीआर तो होता है, एमआर के बारे में
हाँ वो करता है,
वो करते हैं ना, वो कह एक्सेप्ट है क्वेश्चन,
एक्सेप्ट
एक्सेप्ट है। हाँ हाँ एमआर होगा ना,
एलिमिनेशन की वजह से
हाँ
एमआर होगा।
सी या डी में से कोई चूज करना है। मेरा नहीं ख्याल कोई इंट्रिंसिक एब्नॉर्मैलिटी माइट्रल वाल्व की होती है।
15 seconds.
मैंने कहा कि अगर पेपिलरी मसल जो है आगे पीछे
फिर डी कर लूं,
पेसमेकर मीडिएट
वो जल्दी बताएं, सी या
7 seconds. Hurry up.
डी, ऑप्शन डी, ऑप्शन
D
डी
for Delta. Okay,
Yes,
option D. Oh, this one is correct.
इंट्रिंसिक में है पेपिलरी मसल
It was a googly but well played AFIC. Well done. You did well just at the last moment. Good one. So question number 5 on your screen now.
In echo lab, someone argues that it might be a possibility that this patient has athlete heart. Which of the following is not present in athlete heart? Option A, LV cavity greater than 45 mm. Option B, left atrium enlargement. Option C, bilateral ECG patterns. Option D, VO2 increase greater than 110%. And option E, decrease LV thickness with deconditioning.
अच्छा
एनलार्जमेंट होती है या नहीं होती एथलीट्स में?
एल एनलार्जमेंट नहीं, लेकिन बाजार इसी पैटर्न्स भी तो नहीं होने चाहिए।
नहीं होती है ना, होती है
एथलीट हार्ट में कहाँ
आते हैं वेरिएबल इसी पैटर्न आते हैं एथलीट्स के हार्ट में तो आते हैं।
डिक्रीज्ड एलवी थिकनेस फिर डीकंडीशनिंग होती है, VO2 मैक्स 100 110 से ज्यादा होता है, एलवी कैविटी डायलेशन एलवी कैविटी
से कम होती है वो is not present.
इज नॉट प्रेजेंट, डीकंडीशनिंग से वो कम आता है। VO2 मैक्स वाला भी ठीक है। पहले एनलार्जमेंट नहीं होनी चाहिए, एथलीट इज सपोज्ड टू बी अ हेल्दी पर्सन, उसका पहले क्यों एनलार्ज होगा?
जो एनलार्जमेंट करती है
30 seconds.
डीकंडीशनिंग
हाँ वो हाँ एलए मेरे ख्याल से, हाँ मैं आई थिंक वी शुड गो विद बी। हाँ ये बी है या ए है? 45 मिलीमीटर्स।
15 seconds.
आई एम गोइंग विद बी मेरे ख्याल से। we'll go with option B.
B for ball.
Yeah.
Okay, option B. Lock it.
Yes.
And it's correct.
Well done, well done, well done.
Very well done.
Well
Very
done.
well done. So 3 6s in a row. I think the way the discussion was going on, we really enjoyed it. Well played.
Well, they're already.
Wow, thank you sir.
Just need one more to tie and another one to win. Next
तो होने
question,
हो
please.
गया
टाई हो गया।
जीतने के लिए
हाँ
Yes, yes. It's a tie already.
अब ये क्वेश्चन डिसाइड करेगा।
In this patient, resting gradient at LVOT is 39 mm of mercury and he is in NYHA class 3 at presentation. What is the rate of progression to NYHA class 3 from class 1 in patients with LVOT gradient more than 30 mm of mercury?
Patient
Option A,
resting
1% annually. Option B,
Are you sure?
3% annually. Option C, 5%. Option D, 7%. Option E, 9%.
And the timer starts now.
1 से 3 में LVOT gradients from for gradients more than 30।
बहुत ज्यादा नहीं करनी चाहिए वैसे देखिए।
नहीं 7 आपने कहीं पढ़ा है?
मुझे क्यों लग रहा है कि 7 मैंने कहीं पढ़ा है?
Resting gradient 30 is
30 के बाद मुझे ऐसे यार मुझे लगता है थोड़ा कम होना चाहिए। मुझे 7 लगता है, पता नहीं क्यों फीलिंग में 7 एनुअली कुछ था कहीं।
1 3 5 7 9
37 के बाद एलवीओटी
इसलिए
प्रोग्रेशन एनुअली जो नहीं वेट
इतना ज़्यादा नहीं होना चाहिए वैसे वाकई। 7 तो
7 तो एएस का था,
हाँ
एओर्टिक स्टेनोसिस का है।
हाँ 7 तो और चीज़ है, इसका थोड़ा होना चाहिए। हाँ आई डोंट थिंक इट शुड बी मोर देन 1 या 3% से ऊपर नहीं होना चाहिए इसका। हाँ
मैक्सिमम 5
हाँ
7 आई थिंक एएस का था, मैं कंफ्यूज कर गई।
30 seconds.
मेरा भी ख्याल है ठीक है ना, मेरे ख्याल से ठीक है। इट्स रैंडम गैस लोकेटिंग मेरे ख्याल से। हाँ
You need 1 6 on 5 balls, so that shouldn't be a problem. 15 seconds.
We're going with Bravo, ठीक है? We're going with B, Bravo.
B, Bravo. Lock it.
Yes.
And well done. Very well played.
Well, they've already won the game.
That's for sure. They have. So,
Shall we call it a day or should we proceed?
I think 4 in a row. Well done. So, what should we do now? I think we already have the winners.
I think we should declare.
Yes. I think that
no
would
point.
be. Yes, I totally agree with you, sir. I think it's the umpire's call, and we have Professor Ishaq there. So
yeah, I think I would like to declare AFIC as a winner today.
Very right. So we do have the winners as per the verdict. And AFIC Lions, what a game. It was a slow start, but then when you picked up, it was 4 6s in a row. Very well done.
Excellent.
And commiserations to Multan. I think you tried your best, but it wasn't your day. And it's always the participation which matters. So well done to both the teams. And I'd like to take the input from our esteemed council members. We have Dr. Abdul Hamid Siddiqui. Sir, your input for the match and how the game has gone.
I think first of all, congratulations to FI's team for winning this competition. Obviously, the scenario, both were difficult scenario, but probably after initial hiccup, they had good ride and had consecutive 4 6s. So that was the winning moment. So anyway, good luck for the MIC Panther as well. Hopefully they would be better off in next competition. So as declared by Professor Ishaq, I think we can call it off.
Thank you very much, sir, for your kind words. And I do see Dr. Asif Nadeem. Is he there? Can he hear us?
Yeah, thank you very much. And Assalamu alaikum to everyone. So this was a great. And this was the same situation in which AFIC were a few weeks back. They were totally strangled, you know. And it's a great match. And we are very thankful to the Wilson's team and all of you to be there. And congratulations to our team. Thank you very much.
Thank you very much, sir. I think your team did very well. So they turned the tables, and it's always about the fight that you put up. So
yes.
No doubt, and congratulations.
Brigadier Siddiqui needs to be congratulated as well because he's from AFIC, so it was his team.
Yes,
so
yes.
He looks very happy. Initially, I saw him a little bit upset when the first 2 or 3 balls were, you see, went wrong. But I think
so they started with the bouncer, but
he must be congratulated.
So although Brigadier Asif Nadeem is the mentor of the FIC
once
team.
Again, and I think combination of boys and girls works better. So I think Multan should have 1 or 2 girls. They would have better results in future.
Next time, inshallah.
Very right, sir. Very right. In fact,
because the latest developments जो है ना, ये लड़कियां बहुत पढ़ती हैं. Guidelines and latest developments. So I think आपकी टीम में लड़कियों का आना बहुत जरूरी है. And they give you good advice.
Yes, these are the pearls. Please take home the pearls.
सर ये आपकी बात बिल्कुल ठीक है. लास्ट टाइम जो है ना वो फैसलाबाद से वो सारी लड़कियां थी तो वो they also didn't do well. Combination ठीक रहता है. आपकी observation ठीक है.
You have the mix of both. Totally agree. Well, actually, although Dr. Abdul Hamid Siddiqui, I could see him in the dark. He's not that clear. But when, his team was performing well, I could see the glow that was coming off. So, yes. So, I think well done to both the teams. And, Sir, Professor Ishaq, I think any final words? Both teams.
Zindabad, Hamza did very well today. And I think I enjoyed the quality of questions and एक चीज हमने पहले ही पॉइंट आउट की थी कि ये परसेंटेज वाली चीजें न रखा करें बिकॉज वेरी डिफिकल्ट. हालांकि इस दफा परसेंटेज वाले भी जीत गए हैं. सो थोड़ा सा बिकम्स अ बिट डिफिकल्ट बट एनी हाउ डिफिकल्टी आपको बनाता है विनर. सो आई थिंक थैंक्स टू विल्सन, थैंक्स टू यू, थैंक्स टू Brigadier Siddiqui, Asif Nadeem and everybody And indeed, thanks to both the teams, and MIC should not take it to the heart. They should work hard and pick up things. This is a game, you see. Somebody has to lose, somebody has to win, and that's part of life. So I think FIC needs to be complimented. And from my side, I would like to say goodbye to all of you. Thank you very much.
Thank you very much, sir. I think
Thank you. Goodbye.
Our experts with their comments, and I think all those comments are extremely important. Two teams, they both performed really well throughout the course of the tournament. I think now we have the semi-finalists, and hopefully we'll have a wonderful match. In fact, a couple of matches there. So I would like to thank Wilson's Pharmaceutical, Pakistan Cardiac Society, and not to mention our technical team, which puts up the show. So I think well done to everyone. And with this, I would now like to sign off. Thank you very much. Allah Hafiz. See you next time.